in such a way that they are contaminated with debris and potentially significant quantities of bacteria from the start. A puncture wound is an excellent example of this type of wound. Because there is often large numbers of bacteria seated in these wounds, they should not be closed. Closing such a wound prior to controlling the infection often leads to an abscess or pocket of pus.
Would they put a drain
finally,
in that?
The final classification of wound.
What? Would they put a drain tube in that?
Depends.
Oh, okay.
So what I do is probe the wound.
See how far it goes?
See how far it goes underneath the skin, how much the skin is pulled away from that other layer and created that pocket. So that wound, that drain is there to help not create a seroma or fluid developing underneath the skin of where I've closed. If you have big pockets that has that availability for the fluid to pool into, then it will do so. Okay. So that's when you create a drain, is when you actually go up and you can actually feel underneath the skin and they have pockets.
Okay.
Okay. So just one puncture wound that doesn't go anywhere else, I would let it heal from second intention, inside out. You don't want to suture that closed because then you have that pocket underneath what you just closed that fluid can grip into. So remember, if you leave a pocket, no matter if it's a puncture wound or a tearing of the tissues, you're going to create, fluid's going to go there.
Is the infected wound. This wound is obviously infected at the time of treatment.
Well,
a cat bitten by another cat may not be brought to the veterinarian until several days after the incident. At this time, the wound has already developed into an abscess and is obviously infected.
Yeah, that is
I actually like doing that.
Infected wounds must always be allowed to openly drain until the infection is under control.
There's another reason you place the
is not true of the inflammatory